Baxter Healthcare proudly offers PREVELEAK, a surgical sealant that combines speed, strength, and flexibility. The double-barreled syringe contains equal volumes of purified bovine serum albumin and polyaldehyde, which come fully prepared and do not require mixing prior to application. When the plunger is depressed, the mixing occurs in the tip of the syringe. Outside the surgical field, prime the syringe by discarding the first 0.25 milliliters of sealant immediately prior to use. PREVELEAK is designed for simple and precise application. The pressure applied to the plunger affects the viscosity of the sealant, allowing for precise application, and adhering to dry surfaces and those devoid of free-flowing blood. With quick plunger depression, PREVELEAK will initially apply in a thin, less viscous layer. With slow depression of the plunger, it will initially apply in a thicker, more viscous layer. Once applied, the sealant rapidly cross-links with tissue or graft material to form a strong and stable bond. The natural golden tint allows for precise placement while keeping suture lines visible. The sealant will stay where it is applied and won't leak through suture holes. Upon application, PREVELEAK gels in 10 to 15 seconds, with a seal achieved in 60 seconds. PREVELEAK has the strength needed to quickly and confidently seal high-pressure suture lines, with a burst strength in excess of 500 millimeters of mercury. The seal functions independently of the coagulation system, making PREVELEAK ideal for patients taking anticoagulants or antiplatelet agents, or those with other coagulation deficiencies. PREVELEAK is appropriate in a wide range of procedures, such as aortic, extremity bypass, carotid, hemodialysis access, and grafting. It effectively seals needle holes in both synthetic grafts and native vessels, and works equally well on large and small vessels. While strong, PREVELEAK also has the flexibility that supports natural functioning and movement of vessels. It stays flexible after application to the site, making PREVELEAK useful on highly pressurized vessels. Because there is minimal swelling with PREVELEAK, it can be placed on small vessels where swelling can be a concern. The inflammatory response is similar to that observed with PTFE grafts and sutures alone. In the event that sealant is placed where it isn't needed, PREVELEAK can be easily removed from instruments and from tissue, reducing the potential for damage. The sealant that is placed on suture lines is biocompatible. PREVELEAK provides the proven performance you need to confidently seal high-pressure suture lines.
PREVELEAK surgical sealant indications and important risk information. Indications. PREVELEAK surgical sealant is indicated for use in vascular and cardiac reconstructions, excluding application to arterial and venous grafts used in coronary artery bypass graft surgery, to achieve adjunctive hemostasis by mechanically sealing areas of potential leakage. Contraindications. Not for use in patients with known allergies to materials of bovine or shellfish origin, not for intravascular use. Not for cerebrovascular repair or cerebrospinal leak repair. Important risk information. Do not use as a substitute for sutures or staples. Open lumen procedures require protection of the lumen. Avoid exposure to nerves, including the sinoatrial node and the atrioventricular nodes. Do not use in the presence of obvious infection and use with caution in contaminated areas of the body. Do not allow either the uncured or polymerized form to come into contact with circulating blood. PREVELEAK surgical sealant contains a material of animal origin that may be capable of transmitting infectious agents. Repeated use of PREVELEAK surgical sealant in subsequent surgeries has not been studied. Hypersensitivity reactions were not seen using PREVELEAK surgical sealant, but hypersensitivity of BSA has been reported. Avoid tissue contact with material expelled from delivery tip during priming. Avoid contact with skin or other tissue not intended for application. Do not use blood-saving devices when suctioning excess PREVELEAK surgical sealant from the surgical field. Avoid pausing more than 10 to 15 seconds between priming and application to prevent polymerization within the delivery tip. Minimize use in patients with abnormal calcium metabolism, e.g. chronic renal failure, hyperparathyroidism. Safety and effectiveness of PREVELEAK surgical sealant in minimally invasive procedures have not been established. Polyaldehyde-treated tissue can have an enhanced propensity for mineralization. Evidence of cytotoxicity was observed during cell culture-based laboratory assays and is believed to be due to the polyaldehyde component of the product. No evidence of cytotoxicity was observed in animal or clinical studies. Do not use PREVELEAK surgical sealant on arterial or venous grafts during coronary artery bypass graft surgery. PREVELEAK surgical sealant may reduce the vasoreactivity of vascular, i.e. internal mammary artery, radial artery, or saphenous vein, grafts used in coronary artery bypass graft surgery at the site of application. Use in specific populations. Use of PREVELEAK surgical sealant in pediatric or pregnant patients has not been studied, RX only. For safe and proper use of this device, please refer to the full instructions for use.